Let's look at the normal BP variations during pregnancy. During the early weeks, we are all aware that the blood pressure falls but climbs slowly later in the later pregnancy to reach the pre-pregnancy levels at term. And the BP should be measured with the arm at the level of the heart, which means that the cuff size should be appropriate size-wise and appropriately tied at the circumference of the arm. Many a times in very thin women or very obese women, you may not get the appropriate cuff size, and so the BP reading may be absolutely inaccurate. And one looks for Korotkov 1 for systolic blood pressure and Korotkov 5 for diastolic blood pressure. If the diastolic blood pressure is persistently less than 40 millimeters of mercury, then one can use the muffling of the fourth sound and make a note of it. What about the blood pressure equipment? We all understand that eventually it is the mercury sphygmomanometer which is the gold standard, and the calibrated devices like the automated BP machine or the calibrated aneroid devices, they have not yet been validated and they probably may under or overestimate the blood pressure. So what I usually tell my patients is, if we have to do a domiciliary BP monitoring, they can use either of the two, the automated BP machine or the calibrated aneroid device. But whenever they come for a checkup, they must get the device and they must calibrate it to the mercury sphygmomanometer. What are we trying to prevent? Obviously the cerebrovascular accidents, eclampsia, the cardiac problems leading to cardiac failure, and an abruptio placentae.